Good morning, everybody who is attending my lecture series. Today, I will discuss on diabetes, mellitus, and anesthesia. Diabetes mellitus is the most commonly occurring endocrine disease found in surgical patients. 25 to 50% of the diabetics will require surgery. It has a broad spectrum of severity, and its manifestations can be altered in reaction to the patient's metabolic stress. Although the most serious complications of diabetes mellitus are related to its character as a chronic disease, it can cause difficulties in the short-term management of acute illness. Occasionally, diabetes mellitus remains clinically inapparent until the exacerbated by disease of trauma or surgery. Now come to the definition and description of diabetes mellitus. Diabetes mellitus is a group of metabolic diseases characterized by hyperglycemia resulting from defects in insulin secretion, insulin action, or both. The chronic hyperglycemia of diabetes is associated with long-term damage or dysfunction and failure of different organs, especially the eyes, kidneys, nerves, heart, and blood vessels. Several pathogenic processes are involved in the development of diabetes. These range from autoimmune development of diabetes, autoimmune destruction of beta cells of the pancreas with consequent insulin deficiency, to abnormalities that result in the resistance to insulin action. The basis of abnormalities in the carbohydrate, fat, and protein metabolism in diabetes is efficient action of insulin on target tissues. Deficient insulin action results from inadequate insulin secretion and or diminished tissue responses to insulin at one or more points in the complex pathways of hormone action. Impairment of insulin secretion and defects in insulin action frequently coexist within the same patient, and it is often unclear which abnormality, if either alone or is a primary cause of the hyperglycemia. Classification of diabetes mellitus and other categories of glucose regulation. assigning a type of diabetes to an individual often depends on the circumstances present at the time of diagnosis, and many diabetic individuals do not easily fit into a single class. Patients with any form of diabetes may require insulin treatment at some stage of their disease. Such use of insulin does not of itself classify the patient. For the clinician and patient, it is less important to label the particular type of diabetes than it is to understand the pathogenesis of the hyperglycemia and to treat it effectively. The etiologic classification of diabetes mellitus, that is the type of the diabetes, that is type 1, is diabetes results from the beta cell destruction, usually leading to absolute insulin deficiency. Type 2 diabetes results from a progressive insulin secretory defect on the background of insulin resistance. Other specific types of diabetes due to other causes, as for example, the genetic defects in beta cell function, genetic defects in insulin action, and diseases of the exocrine pancreas such as the cystic fibrosis, and drug or chemical induced such as in the treatment of HIV, AIDS, or other organ transplantation. Gestational diabetes mellitus, diabetes diagnosed during pregnancy that is not clearly overt diabetes. Now we come to the end of my lecture series. For today, I will come with more information in my next lecture series. Thank you.